Welcome back to KVUE News Midday Time now 11:24. All Texas adults are now eligible to get the COVID vaccine, but some women are thinking twice about getting a shot in the arm. Some of the concern fueled by a viral post claiming the vaccine could cause infertility. Dr. Kaylin Silverberg is a reproductive endocrinologist and the medical director at the Texas Fertility Center. He's joining us this morning. Good morning to you, doctor.
Hi, how are you?
Good. Tell us first, where did all of this sort of concern come from? It stems from an article, right?
Right, it does. So there was a German physician back in December who raised some concerns, and there were legitimate concerns, and he's doing what he was supposed to be doing, but he raised some concerns about the fact that there appears to be a small sequence of DNA and also of protein in common between the virus, potentially the vaccine, and a protein that's involved in the placenta. And so his concern was, hey, listen, if this vaccine is going to induce the body to make antibodies to this specific protein, could it, not that it does, but he asked the question, could it adversely affect implantation because it would affect that protein in the placenta? Well, the answer is we don't know with 100% certainty because, the virus is still relatively new. We don't know much with 100% certainty. But as of now, there appears to be no increased risk either for infertility or for pregnancy loss. And one other thing that wasn't even considered when he raised this concern about it potentially infertility or raising the instance of infertility, the only way you can lose a pregnancy and the only way you can get a placenta is if you get pregnant, right? So it doesn't make any sense at all that it would lead to infertility. The American Fertility Society has said that there's no evidence that it leads to infertility. The American College of OB-GYN has said there's no incidence. In the Pfizer study, 37,000 patients went through the Pfizer study. Even though patients were instructed not to get pregnant in that study, 23 did, 12 patients who got the vaccine, 11 patients who got the placebo. No risk of infertility, no increased risk of pregnancy loss or miscarriage.
There is concern of that it is so new and that there hasn't been enough time. So what are you telling your patients, or what are you telling women who want to get pregnant? Should they get this vaccine?
Yeah, they should. And let me tell you why. Number one, the Center for Disease Control says they should. The Center for Disease Control is usually right. Number two, we know that COVID is unpredictable. So we can't tell when you get COVID, if you're going to get it in a mild case, if you're going to be asymptomatic, or if you're going to get a severe case. But what we do know is that if you get it and you're pregnant, those cases tend to be more severe. So that's a known, that if you get infected with the virus and you're pregnant, those cases are more severe, which is a good reason that women who are pregnant or trying to get pregnant should get vaccinated in advance.
Have you seen, or is there any precedent of vaccines impacting fertility?
No, I mean, we know there's certain vaccines that we give a warning about. For example, the German measles vaccine, you need to wait for a period of time after you get vaccinated before you get pregnant because we know that could potentially cause an issue. There's certain viruses that we know can cause problems in pregnancy, but they cause problems usually at a very specific time. For example, chickenpox, that can cause problems in pregnancy at the very beginning of pregnancy or at the very end, but rarely does it cause an issue if you get chickenpox in the middle of a pregnancy. Same thing with herpes. It can cause problems if you get it at the very beginning of pregnancy, and it can cause problems around the time of labor and delivery. But the rest of the time, or if you've been exposed to it before and you're just having another outbreak, it doesn't appear to cause a problem. So every virus is different. And the most important thing to remember is this virus has been around for 14 months, 16 months maybe. It may be 5 or 10 years before we know the ultimate answers to these questions. And unfortunately, even though they accelerated vaccine development and they were able to get this vaccine out in record time, there's no way to accelerate the period of time we're going to need to be able to answer all the questions about what comes next.
All right, but bottom line, Dr. Silverberg, you say is if you can, go ahead and get a vaccine.
Please, 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 please.
All right, Dr. Silverberg, we thank you so much for taking some time to chat with us today.
Thank you so much.